Welcome back to Cheddar's News Wrap. We're learning more about a possible coronavirus vaccine timeline after Pfizer announced promising news about its COVID-19 candidate. Meanwhile, on the treatment front, the FDA granting emergency use authorization for Eli Lilly's antibody therapy. So what does all of this mean for going back to life as normal, whatever that means anymore? Let's bring in Dr. Richard Besser, President and CEO of the Robert Wood Johnson Foundation and former acting director of the CDC, to answer that and much more. Dr. Besser, welcome back to the show. First, Health and Human Services Secretary Alex Azar saying today that the government will have enough COVID-19 vaccines from Pfizer available for all first responders and senior citizens by the end of December or early January, and for all Americans by spring. So, Dr. Besser, my question to you, what do you make of this timeline?
Well, I think that may be a little overly optimistic. I would say I'm cautiously optimistic based on the report from Pfizer yesterday, but there's still a lot of information we don't know. This is a company report, and we need to wait for this to be independently assessed by impartial scientists. But the idea that a vaccine could be as much as 90% protective is exciting news. This was looking at protection 7 days after the second dose of receiving the vaccine. They're going to need to look at this at 28 days, and they're going to need to follow safety for a full 2 months before deciding to go to FDA to request emergency authorization. If it's all approved, they say that 15, 20 million doses will be ready, but there are real challenges in terms of distribution of this vaccine and how that's going to be done, given the necessity of maintaining this vaccine at extremely cold temperatures while it's in transit and at healthcare facilities.
So yes, can we talk about that a little more? Tell me more about the obstacles when it comes to logistics and distribution of a vaccine. One of the things you mentioned is temperature that I think a lot of us didn't realize. What else should we know?
Yeah, so this vaccine, it's a new type of vaccine. It's something called messenger RNA. And it's an exciting approach to making vaccines because it can be manufactured very quickly. But something about this vaccine, it's a protein. As that sits at room temperature, it starts to fall apart. And so it has to be maintained at temperatures of minus 90 degrees Fahrenheit. So that means like on dry ice. Most healthcare facilities and hospitals don't have freezers that hold things at that temperature, so that's a real challenge. It comes in large quantities, and so as it's shipped out, there has to be in place the ability to vaccinate several hundred people if you don't want this vaccine to go to waste. So I'm encouraged, but there are a number of hurdles here, and it's not going to change what happens this winter. This winter, if we truly want to see numbers going down, we're going to need to see more governors getting on board with putting in place, mandates for mask wearing. We're going to need to see people willing to wear masks and keep socially distant and wash their hands. And just as importantly, we're going to need to see Congress coming together across the aisle and providing supports to people so that people have income in their pockets to forestall foreclosures and evictions and to put food on the table. There are millions of people who are at risk of eviction in January, and a vaccine isn't going to prevent that.
So many good points there, Dr. Besser. Let's say a vaccine is widely distributed by the spring. Does that mean life back to normal by next summer?
I wish I could say that, and I don't want to dampen the enthusiasm too much, but I think the answer to that is no. It's going to be longer than that. It will change. If this vaccine truly is 90% protective for the longer term, then I would envision people who are vaccinated would be able to go to work and may not need to wear the protections of others. But children, these vaccines. Pfizer has started to test their vaccine in children as young as 12, but in general, the vaccines that are being tested are not being tested yet on children. And while most children will do well with this, not all will, and children can transmit to others. And so it's going to be gradual. I would hope that by summer and fall, life will be getting back to the kind of life that we would all like to be leading. But between now and then, it's going to be a gradual process. One of my big concerns, Hannah, though, is that as you look at the polls in terms of people's willingness to get vaccinated, we have a lot of work to do. There's been really a poisoning in terms of people's trust in science and trust in the regulatory bodies that approve vaccines, and we have to rebuild that so that if there are vaccines that are out there and are available, people will want to get them. And that's a big bar to get over, and we have a lot of work to do, to rebuild that trust.
I'm running out of time, but I did want to ask you about Eli Lilly's therapy getting FDA approval. In what cases would this treatment be used, Dr. Busser?
Yeah, so it's an antibody therapy. It only works in people who have mild to moderate illness. It doesn't work in hospitalized patients. So the thought would be people who are at the highest risk of having severe disease. So maybe nursing home patients, people with multiple medical problems. It's still to be determined who should get this treatment. It does reduce the risk of hospitalization in those who receive it. But there's still a lot of work to be done to figure out who that group is, given that there's a limited amount of this drug and its value to most people is pretty small.
It's always such a pleasure to talk to you and get your insights, sir. President and CEO of the Robert Wood Johnson Foundation and former acting director of the CDC, Dr. Richard Busser. Thank you again.
The facts about COVID-19. Scientists and researchers say a vaccine is close. And if you look on social media, you'll see posts like this, claiming you need 2 doses of the vaccine for it to be effective. So let's verify. Will we need 2 doses of a COVID-19 vaccine, and why? Here are sources.
Getting 2 doses of a vaccine is not unheard of.
Infectious disease specialist Dr. Linda Nabha, the CDC, and epidemiology professor Dr. Christopher Byrer from Johns Hopkins University.
And it's based on the immune response, the immunogenicity.
Our experts say that term, immunogenicity, is a measurement of the vaccine's ability to generate an immune response. That measurement determines how many doses are needed.
For example, hepatitis B vaccine is a 3-dose vaccine because about 60% of people are protected with 1 dose, then you get up to about 85 with 2, and then you get up to about 96 or 98 with 3 doses.
And Dr. Nabha says that multiple doses help boost immunity.
You really don't get full protection unless you get that second vaccine, that second shot.
Meanwhile, the CDC directed our Verify researchers to this website. It states that all but one of the COVID-19 vaccines in phase 3 of trial require more than 1 dose. So we can verify that, yes, it is very likely that the COVID-19 vaccine will require 2 doses. And as you heard, our experts say that's not unusual. With your Verify, this is Evan Kozlov.
Good evening, and thank you for joining us. I'm Carlo Cicchetto.
And I'm Barbara Lee Edwards. Today, as anticipated, San Diego County moved back into the state's reopening plan from the red tier into the most restrictive purple tier. The state lists San Diego's adjusted case rate at 8.9.
The news is a big blow to restaurants and local businesses, which must now adhere to even tighter restrictions. News 8's Kelly Hessedall has more on what happens next.
Well, this is certainly a frustrating situation for a lot of business owners, but not a surprise. A lot of owners had been anticipating this news since last week. Businesses now have until this weekend to adhere to the new restrictions.
I think a number of counties are indeed experiencing quite high levels of cases.
And that includes San Diego. Today, the county moved into the most restrictive tier, the purple tier, with an adjusted case rate of 8.9. That means restaurants and gyms must move all of their operations outdoors. Movie theaters, places of worship, and museums must do the same. Retail must cut its capacity from 50% to 25%, a tough blow to businesses as they move into the holiday season. However, unlike the last time San Diego was under tight restrictions, salons, personal care businesses, and playgrounds will be allowed to remain open. California Health and Human Services Secretary Mark Galley.
The virus is not over just because we're tired of it. It doesn't itself put its guard down. It looks for opportunities to spread.
10 other California counties besides San Diego have moved into more restrictive tiers. County Supervisor Nathan Fletcher.
The spread is countywide. The spread is industry-wide. The spread is community-wide. The spread is happening in every sector, in every zip code, in every part of our community.
Today, he announced they've sent letters to local mayors asking them to step up enforcement in their cities. They're also sending letters to tourism businesses like Airbnb, asking them to comply with the public health order and ban large indoor gatherings. They're also giving 40,000 masks to law enforcement to pass out where needed.
There are only so many things that we can do as a county in terms of putting in place guidelines There has to be proper enforcement.
This Thursday, the county will begin posting on its website case rate and testing positivity by municipality and zip codes. San Diego will remain in the purple tier for at least the next 3 weeks. Kelly Hessedall, News 8.
Meantime, still relatively high numbers of new COVID cases being reported by the county. Today, health officials reported 483 new cases. That's 5% positive of more than 9,000 tests. 5 new community outbreaks are being reported, making 39 over the past week. 7 more people died from COVID. That total is now 915. But some businesses won't be impacted as hard as in previous closures. News 8's Abby Alford is in La Mesa to explain.
The purple tier could be devastating to our businesses, especially right in the middle of the holiday shopping season. But doctors say our health and safety is our top priority. So let's take a deeper look into the purple tier and try to make sense of it and how it differs from our closures and reclosures in the summer.
San Diego County has avoided the most restrictive purple tier for weeks, but only because testing is up.
We have to stay vigilant and we have to be exercising cautions even now when we are in this purple tier.
Our unadjusted case rate is 10, which Governor Newsom warns could move us into the purple tier tomorrow.
But anticipate that we'll see some counties moving backwards, not forwards. And this is exactly why we designed the tier status the way we did.
Moving from the red to the purple tier will limit capacities or move customers outdoors at restaurants and shopping centers. But let's take a closer look and compare previous closures and reopenings to what we may face tomorrow. Back in May, playgrounds, hair salons, and personal care businesses remained closed well after restaurants reopened. This time around, they can remain fully open. Gyms, churches, theaters, and museums will be expected to operate outdoors.
There are a lot of nuances and differences between all of those places. And, I think a blanket approach doesn't always make the most sense.
But with infection rates going up within small gatherings, this really worries doctors. San Diego's one medical regional director and family physician, Natasha Bouillon, says, especially around the holidays.
And what I worry about is if we're in the purple tier and businesses are facing restrictions, we also need to do our part and limit those small social gatherings inside our homes.
And always wear a face covering, wash your hands, and maintain at least a 6-foot physical distance around anyone outside of your household.
The county says if we move into the purple tier, those restrictions could start Saturday at midnight. When we asked them about enforcement, they said that they would update us during their media briefing tomorrow at 2:30.
San Diego County could be only a day away from the state's most restrictive tier.
If our adjusted case rate is higher than 7 per 100,000 people tomorrow, we will be forced to move from red to purple in the state's 4-tiered reopening plan. News 8's Brandon Lewis has more on what that would mean.
Now, Carlo and Barbara Lee, we spent several weeks hovering at the upper limits of the red tier, and now our unadjusted case rate calculates to somewhere around a 10. So we would need a significant amount of testing to have been done in the past week to avoid us moving into the purple tier.
I anticipate tomorrow, you'll hear from Dr. Galley, that we will see more restrictive tiering based upon case rates that have begun to increase.
San Diego County could join others across the state in moving into the most restrictive purple tier. It would push businesses outside or limit capacity in an effort to curb the spread of coronavirus.
People are letting their guard down. They're taking their masks off. They're starting to get together outside of their household cohorts. They're starting to see businesses reopen, and we're starting again to see more people mixing.
At worst, we could be entering a third wave of cases. Our worst to date happened over the summer and took about 8 weeks to control. An increase in hospitalizations lagged by just a few weeks. Governor Newsom says it follows a similar curve seen during the 1918 flu.
This was anticipated. No one is surprised by this. If this virus follows similar trends, we could anticipate something along those lines again. History may not repeat itself, but as they say, it rhymes.
If San Diego does move to purple, we would have to stay there for a minimum of 3 weeks. We could only go back to red once our adjusted case rate is at or below a 7 and stays there for 14 consecutive days, which may prove challenging with the upcoming holidays.
It really matters who's been in your stable sort of cohort, who you live with in that household that matters. So it's not a surprise that we see household gatherings as a major source of transmission. But
at the same point, it's a place where we can make important inroads. Our own choices can really reduce that transmission.
State health officials will calculate our case rate tonight and then release it sometime before noon tomorrow. Our local county health officials are expected to speak to the public sometime about 2:30 tomorrow. Carlo and Barbara Lee.
All right, thanks, Brandon. San Diego County released new coronavirus data today ahead of tomorrow's reassessment by the state. 401 new cases were reported today. That's 4% of more than 10,000 tests taken. The 14-day rolling average is 3.3%. Hospitalization rates had a spike over the last week, up to the same levels they were back in August. No new deaths were reported today. That is typical for a Monday. Tomorrow, we'll know if San Diego moves into the state's purple tier that we were talking about, restricting in-person business.
Anticipate that we'll see some counties moving backwards, not forward.
Local businesses brace for a big announcement today.
Businesses preparing for changes ahead of the holiday season. I'm Evan Arani at Liberty Station with The Impact.
It could be a major step to help get kids back in the classroom. San Diego Unified's plan to provide coronavirus testing.
It's a very scary time for women on top of feeling terribly, terribly ill.
Morning sickness is a common part of pregnancy, but a severe case may be a sign of something more serious. I share my story and advice from doctors.
A pivotal day in the fight against coronavirus in San Diego. Today, local businesses could face more restrictions as schools work on a plan to get kids back into the classroom.
And this morning, we do have team coverage. Chris Groh is following San Diego Unified's COVID-19 testing plan. But we're going to begin with Evan Arani, who has a preview of the state's announcement today. We're just waiting to see whether we stay in the purple or we move to the purple or stay in the red.
Yeah, exactly. That's going to kind of be the big question, and businesses are already planning around the possibility of moving into the purple tier. You may be able to hear a little bit of sound behind me. We're at Spark Cycle right in Liberty Station, where they've moved all of their spin classes outside. So they are entirely taking place outdoors, and that's where people are lining up and getting onto their bikes. And that's because if we do see the county move into the more restrictive purple tier, all indoor gyms will close, all indoor dining will close, and we'll see retail capacity limited to 25%. So businesses already ahead of the announcement today are bracing themselves. But because of our COVID case numbers, things are not looking too good for the county of San Diego. We see a really good possibility of moving into that more restrictive purple tier.
Please wear your mask. Please maintain your physical distancing, and please follow the county and state regulations. It will only help us all to make sure we don't fall back into this purple tier, that we get to red quicker, that we get to orange, and that we get back to normal.
So most restaurants and gyms have made significant adjustments to follow pandemic guidelines, like adding more outdoor space. But with rain and cooler temperatures, being outdoors can also hinder business. The holiday season can be one of the most profitable times for businesses. And as we see the chance of moving toward more restrictions this afternoon, a lot weighing on the announcement from the Public Health Department as it comes this afternoon. So for those businesses, they're asking you to continue to help them where you can. If you can normally sit at a restaurant, then you can do so for now. If we move into the purple tier, you won't be able to sit in restaurants, but they do ask that then you order takeout meals. For retail stores, you can often order a contactless pickup or have it delivered to you. So all of these businesses are asking that you still support them during the holiday season, as things could get especially tough for them going into the rest of the month of November and into the month of December. They say regardless of what tier we're in, whether it's in the purple or the red tier, this year has already been a really tough one overall, and they could use your support where you are able to help. So again, we're outside of Spark Cycle. They're just getting underway with their 6 a.m. class. So we'll keep you updated if we hear anything more. We'll send things back to you.
Evan, thank you. And today could mark another step toward getting kids back into the classroom.
San Diego Unified will vote on a testing plan for all students and staff. News 8's Chris Groh is live outside district headquarters to break down this proposal. Good morning to you, Chris.
Good morning, Eric and Stella. And this goes hand in hand with their reopening plan. They want to be able to test students and staff every 2 weeks. And what's great about this testing program is that it would help them also identify asymptomatic students or staff as they enter, or before they enter, I should say, any classrooms or campuses when they do start to go back to full on or in-person learning, or even that hybrid model, which is part of phase 2. So this would be a partnership with UC San Diego, and it's going to cost up to $5 million. But this proposal does come the same day the district is considering moving forward in its reopening plan, so it is going to be one of those necessary dominoes. So this testing program does go hand in hand with that. As for what that next step in the reopening plan is, well, currently, remember, we're in phase 1 of San Diego Unified's reopening plan, and in that phase, only elementary students with the greatest needs are allowed on campus for appointment-based sessions. But today, they'll consider expanding that to all grades within the school district, but they would still be in phase 1. Remember, it's still phase 1. Phase 2 is a hybrid school model. That's going to be partly online, partly in person, but that's not slated to start until January 4th for elementary age children and all students on the 25th of that month. Now, the reason I bring that up is because the district has said they will not move to phase 2 if the county is indeed in the purple tier, the state's restrictive COVID-19 program, which we could find out a little bit more about today, what our future will hold, as you heard Evan just touch on there. So a lot of dominoes could be falling here today for San Diego Unified, for both teachers, students, staff, and parents. Eric and Stella.